So this is sixth part of epistaxis. So in this video, we are going to see how we control posterior bleeding from the posterior part of the nose. How we are going to control that with posterior nasal packing. So when you say posterior nasal packing, generally it's termed like that, but usually it is posterior and anterior combined together. And usually the indication for it, if it's a single spot, we cauterize it. If it is an anterior bleed, anterior part of the nose inside, we control the bleed with the anterior nasal packing. When the anterior nasal packing fails, or we know specifically with the help of an endoscope, is the bleeding is in the posterior part, we'll straight off go ahead posterior nasal packing. Usually the indication being failed anterior nasal packing, we'll go ahead posterior nasal packing. So we'll see how we are going to do that. Now, the posterior bleed is going to be here. The main artery being sphenopalatine artery, which is the artery of epistaxis. So here in this video, I am going to show three techniques of posterior pack. One being traditional method, second is with the help of a foliage catheter, third is with the help of a balloon tamponade. So the first traditional method, what we do is we prepare a gauze piece and we'll have three ties. One on either side, the long ones, and one more in the center. And through each nasal cavity, we'll pass a small catheter and it will be brought out through the oral cavity from the mouth. So you have two catheters here. I have shown like together, it is two different ones. And we have two ties here. It will be tied on each of the catheters. And slowly, when we pull this one, the catheter in the nasal cavity, when you pull this gauze piece will be pulled inside and it will reach the nasopharyngeal part or the choana specifically. The choana part is a place where it is bleeding. So it will sit in the bleeding spot. That is one. So once that is inside, you have two ties here, which is here, that will be tied outside, and one tie here, which will be tied near the cheek, followed by application or placement of the anterior nasal packing, which I have already showed in the previous video. That is traditional pack. One thing I would like to tell you, this pack is not a plain one. It has to be soaked in petroleum jelly or dilute betadine or bismuth iodophone paraffin paste or any antibiotic ointment like piperacin. So that is how we control with the traditional packing. The second technique being foliage catheter. So first we'll suction clean all the nasal cavity, followed by placement of a nasal pack, which will contain decongestion, which controls the bleed, and it will contain a lignocaine so that the patient experiences less pain. So we'll keep that pack for 5 to 10 minutes and we'll remove the pack. We'll slowly introduce the foliage catheter after applying lignocaine jelly. And once it reaches the lowermost part of the nasopharynx, we'll inflate the balloon which is there in the end, near to the end. We'll inflate at least 5 to 7 ml and we'll slowly withdraw the catheter and it will get stuck in that choana part of the nasopharynx and we'll inflate 5 more ml, total of 10 to 12 ml of saline or distilled water will be instilled inside the balloon. That will be placed inside at least for 1 or 2 days. Now, after the placement, this will be tied in the forehead, stuck to the forehead, followed by placement of the anterior nasal packing. How anterior nasal packing I have already showed you and I have given a demonstration also in the previous video. So that is how we place a foliage catheter. Foliage urethral catheter, usual number being 12 or 14. So these are the two I am going to give you a small demonstration. These are the two medications. And already I have soaked, these cottonoids I have soaked with these two medications. First, I am going to place the cottonoids inside the nasal cavity to have two effects. One is decongestion, and the one is to make it less painful for the patient. So this pack, cottonoids, will be placed at least for 5 to 10 minutes. After that, I will remove the nasal pack one by one. Now, I'll take that foliage catheter 12 or 14 size. I'll lubricate the tip with 2% lignocaine and slowly introduce the foliage catheter to the floor of the nasal cavity till the tip can be seen just below the nasopharynx. And I'll inflate the balloon with 10 to 12 cc of distilled water or saline. That will be in the nasopharynx and inclusive of the choana. That will take care of the bleed. That's it. Now, followed by, I like to place, once the balloon has been inflated, it will be in position. Now, I am placing an anterior nasal packing tube. That's why I told you, whether it's posterior nasal packing, we generally term as posterior nasal packing. It's a combination of anterior and posterior packing. Now, the last one, how do we control the posterior bleed with a balloon tamponade? So, when the balloons are not inflated, it will look like this. So, you have two balloons here, one anterior, another one posterior. The anterior one capacity being 10 cc, that is in the nasopharynx and choana. The posterior one, which occupies the nasal cavity, the capacity being 30 cc, that is the maximum. So, just like the previous one, we have to lubricate this well and slowly introduce into the nasal cavity, and first we will inflate the anterior balloon like how we see here. It will be in the nasopharynx and the choana, and followed by inflation of the posterior balloon, and this will be left in place for 2 to 3 days. The advantage of the balloon is that even a non-ENT doctor who is working in the casualty, they can easily do this. It's very easy to insert, less of pain, less of discomfort, less traumatizing, and suppose there is little bleed, we can, if you want, you can inflate little more, or if you want to check whether the bleeding is less, we can deflate the balloon also, we can control it. So, these are the advantages of balloon tamponade. So, whatever the procedure being, whether it is traditional method or foliage catheter, or we are controlling the balloon, or with a balloon tamponade, any one of these three, the patient needs to be admitted and to be kept. Patient has to be in the intensive care unit. Why? Because whenever we pack the posterior nasal pack, when we pack the posterior part of the nose or the nasopharynx, usually there will be hypoxia, there will be less of oxygen, and they may have cardiac issues too. So, to prevent that, we want the patient to be in ICU in propped up position, and we will start with oxygen inhalation too. That will be 2 to 3 liters, and the patient will be monitored for all the vitals, and ECG could have already been taken. And of course, IV antibiotic will be going on and the mild painkillers, and any of these packs is going to be left in for 2 days, and we'll remove the pack if there is no bleed for 2 days. We'll remove the pack on the 3rd day morning in the operation theatre. Why in the operation theatre? If suppose on removal there is bleed, we can control the bleed in the operation theatre. If it doesn't bleed after removal, just fine, we'll do a nice suction cleaning, and he'll be shifted back to the ward or back to his room. So, once he reaches his room, he'll be observed for 1 more day when he should not bleed at all, and suppose he does not bleed for next 24 hours without any sort of nasal pack and with normal activities, he will be discharged. So, at the time of discharge, you will be given a course of antibiotic, and we have a few advice for you. Try to avoid lifting any weight because it increases the body strain. If you are constipated, we'll prescribe laxatives for you so that you don't have any strain in the restroom. If you are alcoholic, try to avoid drinking alcohol. If you have the habit of smoking, please quit smoking. Avoid passive smoking. Stay on a soft, cold diet, and try to avoid hot liquid and semi-solid foods. Avoid hot, steamy head showers. Avoid sneezing. If at all you are not able to control your sneeze, then try to open your mouth and sneeze. Avoid nose blowing and avoid nose picking too. If at all you want to take any painkillers, take milder ones like acetaminophen, the common name being paracetamol, Calpol, Dolo 650, abroad it is called as Adol, Panadol, like that. So, try to avoid ibuprofen, diclofenac, aceclofenac, COX inhibitors, because all this may have some effect. Likewise, try to avoid fruits, vegetables with high content of salicylates. Try to avoid those also. So, that's how That's how we manage a case of posterior bleed with the help of posterior nasal packing. Thank you so much.